Welcome to this presentation. The Latin phrase primum non nocere means first do no harm. This phrase is traced back to the Hippocratic Oath of the 6th century BC. I am Tony Thomas, National Director of Nursing Health Protection. I do not have any conflict of interest to declare, but my interest, as each one of you listening to me, is to protect and to prevent. As we are on the doorstep of another flu season, let us join hands together to protect and prevent, not to do harm to the people who trust us. Primum non nocere. The aim of this brief presentation is to maximize the utility of some excellent information that our own departments have produced in our efforts to protect the most vulnerable of the society. This is consistent with our national health protection strategy to protect and to prevent. In this chart, the age-specific rate of influenza for 100,000 population is displayed. These are laboratory-confirmed cases of influenza reported on the National Surveillance System called CIDR, C-I-D-I-R. These are hospitalized inpatients by the week of notification in the last flu season, commencing from week 40 to week 20 in 2024. We had almost 17,000 cases of influenza reported on CIDR, and the highest burden was among the 0 to 4 age group displayed in, and the over 65 age group displayed both in olive green and the red bar lines here. In the US, the flu is estimated to 5 to 20% of the population by the American Lung Association, equating that into Irish population of 5 million. We are likely to have 25,000 or 250,000 to 1 million cases of flu reported annually. In this table, the incidence rate of influenza for 100,000 population, these are the hospitalized cases during the last flu season, is displayed. As in most years, the over 65 age group accounted for a significant proportion of the hospitalized cases of influenza. During the last flu season, the over 65 age group accounted for 44% of the total number of hospitalized cases as reported on the National System CIDR. How to prevent influenza vaccination? There is nothing more efficient as vaccination, vaccinate, and vaccine. The World Health Organization recommends vaccination against influenza on an annual basis, and this is for several number of reasons. The immunity from vaccination wanes over time, and annual vaccination is also required to protect against the seasonal variants of or strains of viral influenza. In Ireland, the National Immunization Advisory Council has recommended annual influenza vaccination for healthcare workers since 2008. And the HSE has set a target of more than 75% of vaccination of healthcare workers since 2019. In addition to vaccination, non-pharmaceutical measures such as respiratory hygiene, cough etiquette, hand hygiene, cleaning and disinfection, they all play an important role in prevention of transmission to prevent and protect from influenza. Healthcare worker attitudes on influenza and vaccine and illness data is presented here. This is based on a study done by a Department of Public Health among healthcare workers, and this on influenza and COVID-19 vaccination. This study shows that the healthcare worker uptake of influenza vaccination was a good example for patients, as 93% of the respondents in a large study of over 550 participants. And among the respondents, 3 in 4 of the healthcare workers were confident on advising patients on the benefits and protection offered by influenza vaccination. However, disappointingly, 1 in 3 of the healthcare workers, that is 32% of the almost 600 respondents, stated that they would attend work if unwell with influenza. And this is across the board by occupation: medical colleagues, nursing colleagues, nurses, social care workers, and other occupations as well. Interestingly, almost 50% of the respondents were based in acute hospital settings, and the rest in long-term care facilities, and 35% of these respondents were nurses. Now let us consider the uptake of influenza vaccine among healthcare workers and residents of long-term care facilities. Only the 1 in 2 or every second healthcare worker in an acute hospital setting or an acute sector, and 2 out of 5 healthcare workers in the long-term care facilities availed the flu jab in the last influenza season. This is absolutely disappointing. A significant drop year on year, irrespective of the work location, whether an acute or a residential care setting. Friends, we are failing our people. We are not upholding the principle, first do no harm. We must ask ourselves, are we doing our best to protect the most vulnerable people from flu? We must do more in order to protect and prevent our colleagues, our patients who trust us from influenza. In this table, the healthcare worker vaccine uptake during the 2020-24 season is displayed here. What we see here is a declining trend of vaccine uptake among healthcare workers from the peak of the COVID, that is the 2020 to 21 season, is observed. And this is in the acute sector. These are based on complete returns based on figures as of July 2024. A similar declining trend of healthcare vaccine uptake among long-term care facilities is also observed. The peak in 2020-21 season and declining trend, as you can see there, just over 42% in the last flu season. However, on the positive side, sustained flu vaccine uptake among residents of long-term care facilities was maintained over 80%, and most facilities achieving over 90 to 95% as well. This is reassuring and commendable. And this is displayed across the health HSE regions area A to area F, and the last bar chart shows the cumulative figure across all long-term care facilities in Ireland. This is based on the point prevalence survey from 2017 to December 2023, and that shows the vulnerable people are protected at a higher rate of sustained closer to 90% in most of these long-term care facilities. The next 3 slides that I'm going to present here are based on a review undertaken by colleagues in the Department of Public Health Southeast or Area D in the 2022-23 flu season. This was presented at the Royal College of Physicians in Ireland Summer Scientific Conference in 2023. The review of the flu cases identified that 3 in every 4 cases of flu notified in the 2022-23 season were unvaccinated. As you can see, the majority of cases, that 74% was unvaccinated, and 26% of the cases who were vaccinated also got flu, possibly a mismatch of the vaccine during that particular season. Again, displaying, as shown in this graph, the peak of the flu usually occurs towards the end of the year, that is week 50 and 51, as well as weeks 1 and 2 in the new year of each year. A closer look on the rates as displayed here, the incident rates were highest in those aged under age less than 2 years, and as well as those who were aged over 65 and older. Higher rates displayed in this graph under age 2 and also over 65 group, with lowest incidence at the age of 18 to 64 age group. That shows that one, certainly we need to protect the most vulnerable, the most senior in our population, as well as the children under 2 to 4 years in particular at high risk of acquiring influenza and also associated complications. Based on the review, let us now look into the average length of stay for inpatients over age 65 and older. And this shows that one, in the unvaccinated cases, the average length of stay was 24 in unvaccinated cases compared to 13 days for vaccinated influenza patients over 65 age group. So the additional length of stay was 9 days. The cost of one bed day itself is €813 according to HSE figures latest published. The bed day cost alone in a case of vaccinated flu is over €10,000, and in the case of an unvaccinated case over 65 is double that cost, that is over €20,000 per unvaccinated case. So looking into the cost involved in vaccinating a case, less than €50, including the procurement cost as well as the administration cost. Administering flu vaccine to prevent flu is one of the most cost-efficient return on any public health intervention and investment. This is more than 400 times of cost, primary cost is the rate of return incurred or achieved by vaccinating those who are at high risk of influenza. As public health leaders, clinicians and healthcare workers, how can we optimize vaccine uptake? We as healthcare workers must maximize healthcare vaccine uptake. This should be over and above the HSC target of 75%. It is free, colleagues. Come on, grab the jab. We must aim for full coverage. That means anyone who is eligible for flu vaccine should be offered the flu vaccine. And this should be across the primary care, secondary care, and tertiary care as well. We must innovate. We must reward best practice as well as good performance. Remember, one case of flu in a hospitalized over 65 age patient costs more than 20,000 in bed day cost alone. Friends, suboptimal healthcare vaccine uptake must be a history that should never be repeated. Let us do no harm to the people who trust us. At this stage, may I invite each one of you to come on, to unmute your microphones, and let us together make the pledge. I recommend influenza vaccination. Come on, all of us together. I recommend influenza vaccination. My sincere thanks to all those who collated the data, who undertook reviews and surveys among healthcare workers. In particular, my thanks to the VPD team in HPSC and the area public health departments, both Dublin Northeast and Southwest in Ireland. Thank you.